Hello, and welcome to Chapter 18, Muscles of the Trunk. As with other muscle chapters, be able to name the origin insertion for these 6 muscles: the external abdominal oblique, serratus anterior, external intercostals, internal intercostals, the diaphragm, and rhomboideus major. Know the names and one actions for the rest of the muscles. Know synergists and antagonists for all muscular actions, and you will not be required to know any innervation listed in Table 18.1. Muscles of the abdomen. These are the muscles found on the abdomen, the most anterior aspect of the abdomen. There are 4 pairs of sheet-like muscles: the external oblique, internal oblique, transversus abdominis, and the rectus abdominis. You should be able to identify these muscles in a diagram similar to this. This is a cutout superior view. The functions are to support the viscera, stabilize the vertebral column, help in respiration, urination, defecation, and childbirth. You should be able to identify the lateral abdominal wall muscles in a picture similar to this, where you can see the purple, pink, and yellow color coding. From superficial to deep, you have the external obliques, located in purple, the internal obliques, which you find in pink, and the transversus abdominis, which is found in yellow. Know that all these muscles have opposing actions. So you can see the muscle fibers of the external oblique run superior to inferior, lateral to medially, as well as the internal obliques run superior to inferior, medial to laterally. So they run in oblique fashion to the side wall. All of these muscles are associated with a broad aponeurosis, and the vertical line is called the linea alba, which is present here. The external abdominal oblique, you need to know the origin insertion for this. So the origin are ribs 5 through 12, inserts onto the linea alba, as well as the iliac crest pubis. The action is to compress the abdominal wall and rotate the trunk. The internal abdominal oblique and transverse abdominis actions are compression of the abdominal wall and lateral rotation of the trunk. So how do I get those 6-pack abs? Well, your 6-pack abs are created by the rectus abdominis. In between each muscle there's a small connective tissue band called tendinous intersections. This divides the muscle into segments. Abs can be seen if there is little belly fat and well-developed rectus abdominis muscles. So as the belly of the muscle swells, the tendinous intersections remain the same. While the rectus abdominis becomes developed, the tendinous intersections remain undeveloped. So, rectus abdominis action is to flex the vertebral column as well as compress the abdominal wall. Serratus anterior. It originates on ribs 1 through 8, inserts onto the vertebral border and inferior angle of the scapula, and its action is to abduct the scapula. The inguinal ligament. This is an area where abdominal muscles end. So it forms the base of the inguinal canal, which is the place from which an inguinal hernia can develop. The inguinal ligament runs from the anterior superior iliac spine of the ilium to the pubic tubercle of the pubic bone. It is formed by the external abdominal oblique aponeurosis and is continuous with the fascia lata of the thigh. You have about a 27% lifetime risk of men developing inguinal hernia and a 3% for women. Muscles of respiration. Breathing requires the use of muscles. There are 3 main muscles used in breathing: the diaphragm, external intercostals, and internal intercostals. The contraction of the diaphragm and the external intercostals produce inspiration, so it increases the volume in the thoracic cavity. Contraction of the internal intercostals produces forced expiration, so it decreases the volume. Normal expiration requires little or no muscular activity. It's passive at rest. The elastic recoil of tissues and gravity collapses the chest. The external intercostals and internal intercostals. You need to know the origin and insertion for these. So the external intercostals originate on the inferior border of the rib and insert onto the superior border of the rib below, while the internal intercostals originate on the superior border of the rib and insert onto the inferior border of the rib above. Their actions: the external intercostal elevates the rib, while the internal intercostal depresses the ribs. The diaphragm. The diaphragm originates around the xiphoid process and along the border of all along the lower ribs and along the upper lumbar vertebrae. You can see the diaphragm is very parachute shaped in the picture to the right. It inserts onto a central tendon, which you can see on the picture to the right in the lower side. That view is an inferior view, so if you were to stick your head into an abdominal cavity and look up at the diaphragm, that's what it would look like. So you'd see this large central tendon, and its actions during inspiration, contraction, allows the thorax to increase in volume and your lungs to expand, while relaxation causes it to parachute back up and fill up that dome. Hiccups are involuntary, intermittent, sudden contractions of the diaphragm. The hic that you hear is the epiglottis slapping along the larynx. Now let's talk about some deep muscles of the back. You have the Erector Spinae and the Quadratus Lumborum. There's several muscles listed as Erector Spinae. You only need to know them as Erector Spinae. They extend and rotate the vertebral column as well as the head, while the Quadratus Lumborum's actions are to extend and abduct the vertebral column. This is a deeper muscle found behind the Erector Spinae. Rhomboideus Major and Minor, two muscles that are rhomboid shaped. That's a rhomboid located on the bottom picture of the slide. They originate on the spinous processes of T2 through 9, insert onto the medial border of the scapulae, and their actions are to abduct the scapula. This is the end of the muscles of the trunk, table 18.1. Be sure to skip the innervations, and remember you don't need to know the specific Erector Spinae muscles. Be able to identify the origins and insertions on those 6 muscles listed. You don't need to know any innervations, no actions for all the muscles, and thank you and have a great day.